Cancer or corona? Which is more dangerous in the present world? Well, I am Dr. M V Chandrakanth. I am a medical oncologist in Narayana Hospital, Kolkata. Well, in the present day pandemic of corona, can we treat cancer? Is the whole question which we have. By the way, why this coronavirus is so dangerous? Why are we all so worried? And why the whole world is in a standstill for this small virus called corona? This is not the first time we have seen this coronavirus in our lifetime. We would have seen this for a long time. We would have got exposed to this in our childhood. We would have got some common cold or flu, or we also have got something called red eyes, viral conjunctivitis. We would have remembered where we saw our classmates or friends where they had red eyes, and if we had seen into those red eyes, we also will get that red eye so soon. So from all these, what we understand is virus spread so fast from one person to another. What we call as high communicability. It spreads so fast. Just by looking into the eyes, mind you, it gets spread. Therefore, we were advised to stay far away from them. We advised those children who had red eyes to stay at home. Those children who had chicken pox to stay at home and not to come to class. So we had this concept of isolation right from our childhood days and long before. And isolation is no longer a new concept for us. And that is the gold standard for us even today. So any virus for that matter, is highly communicable. It is so small, it just spreads from one person to another person. Through cough, through droplets, through many ways. Through fomites, just a handkerchief exchange can spread. So that's why communicability is a problem. It spreads so fast from one to another. So then why should we worry about corona? We didn't worry about common cold. We didn't worry about flu. We didn't worry about red eyes because we all knew that within 1 week we are going to be fine and we can go back to school or we can go back to work. But the problem with this novel corona, what we call, the novel COVID virus, what we call, is its conversion to mortality. In simple ways, the chance that I can die of this particular virus, the chance is 3 out of 100. If 100 people are infected, 3 will die because of this small virus. So this is the worry for us, that if I am infected, I may die. 3 in 100 chance, 3% mortality. That is the reason why the whole world is worried. We never had antiviral treatment at any point of time. There is no effective treatment for common cold. We all know if you take tablet, it will go in 7 days, and if you don't take anything, it will go in 1 week. So hardly we have antiviral therapy. For flu or common cold, it goes with Amrutanjan, Vicks and all this. But even in corona, we don't have effective antiviral therapy, but the problem is its conversion to mortality. The moment it gets infected, it will attack our lungs and causes what is called as respiratory distress syndrome. It will prevent my breathing. It will prevent my oxygenation, oxygen entering from lung to blood. So this is a problem, and that is why coronavirus is scientifically named as the severe acute respiratory syndrome virus 2. It's a novel coronavirus. It's a new generation of coronavirus that has come, and that's why it is very dangerous. So this lethal combination of fast spreading, that is infectivity, and its conversion to high mortality, this combination is the problem. It spreads and it kills. This is the problem. Well, what about cancer? Cancer has only one quality. It kills, but it doesn't spread. How much does it kill? The mortality is 30%. If 100 people are affected with cancer, roughly if I put a number, it is around 30% are going to die within 1 to 2 years. And this number of 30% means I can cure around 70% of cancer patients is only when I give effective anti-cancer therapy. That is, I pick up the cancer early, I operate, I treat, I cure with all my best treatment options. So even with the best treatment options, I can cure around 70% of patients only. The rest 30% are not going to get cured. Supposing if I don't give proper anti-cancer therapy, then this cure rate comes down to less than 50%, 40%. So not giving anti-cancer therapy is also dangerous. It also kills these cancer patients. So what do we do in this era, in this pandemic where there is cancer in one hand and there is COVID or Corona in other hand? How do you balance this situation? As an oncologist, I'll speak of cancer. So how do I manage? So should I say all cancer patients that now it is Corona, let us solve Corona first, let this pandemic get over and then I will treat cancer? Am I right by doing it? Or am I harming? Or am I preventing Corona infection in these patients but they die of cancer? So we need to develop a balance where I give effective anti-cancer therapy. At the same time, I prevent these patients from getting infected with Corona. How do I do this? So we have some strategies which we have developed so that we treat effectively for cancer, we reduce cancer-induced mortality. At the same time, we prevent infection with these patients from Corona. So number one is patient selection. The problem with cancer patients is they have very poor immunity. Like for me and you who don't have cancer, a simple common cold or a flu is nothing for me. I just have some sneezing, cough and I'm okay in a week. But for a cancer patient, that same simple common cold or a flu can cause me pneumonia and also it can cause death. That means my fighting capacity, my immunity is not good to fight these simple viruses. And Corona is not an exception. It causes a lot of death in cancer patients. They easily get infected with coronavirus and these cancer patients die of Corona infection very soon. Therefore, we should be very cautious as far as these cancer patients when in this pandemic of Corona. So, what we call as, if I want to treat a cancer patient in this COVID era, I would want to have something called optimal patient selection. In cancer treatment, we deliver treatment in two ways. One is, there are some patients who are good and in early stage, I can treat well and I can cure them. Whereas there is a small subset of population where the disease is already advanced, where even if I give some treatment, hardly they benefit. So my treatment is unlikely to be effective in this small set of population, what we call as palliation or palliative treatment. Whereas the other one where I want to give better, I want to cure them, I want to give them a long-term survival. So the recommendation is, if my intent of treatment in cancer is cure, where I can completely eradicate this cancer, then I should not be delaying anti-cancer treatment even in the era of coronavirus. Because there I am going to cause higher mortality. What I am treating, I am curing 70% cancer patients. It will reduce if I am not offering effective anti-cancer therapy. That's why I need to deliver effective anti-cancer therapy in these curative subgroup of patients. So patient selection matters, number one. Number two is, whenever these cancer patients come to hospital, we need to have adequate personal protection to these cancer patients. Right from cap to mask to gown to gloves, all have to be done, and adequate hand washing need not be stressed more. So personal protection should be very strong as far as cancer patients are concerned when they come to hospital for anti-cancer therapy, like radiation or chemo, whatever reasons they come, we need to have effective personal protective measures for these cancer patients. Well, how can I prevent these cancer patients from getting infected with Corona? The other ways is reduce their hospital visits. How do I do? Supposing a patient has a breast cancer and she needs surgery for the breast. Well, surgery for breast is not an emergency. So they are called what are called elective surgeries. So on all these occasions, I need to have some ways where I can postpone this surgery by 1 or 2 months. But in the meantime, the cancer also should not multiply and increase. How do I do that? So we have got something called hormonal therapy or neoadjuvant chemotherapy, where in this waiting period of surgery, I have some tablets where I can have something called hormonal tablets, or I have something called oral chemotherapy, called oral metronomic chemotherapy. In this period, I can give these tablets and I can prevent the cancer from spreading or increasing. No need of patient coming repeatedly. Just a tablet if I give, it will take care of this 2 to 3 months time where the patient gets this window of opportunity for waiting for surgery so that the cancer won't spread. The other ways are, supposing a patient is on injectable chemotherapy, then I would like to increase the gap between the 2 cycles. Classically, if we have weekly chemotherapy, I would want to give it once in 3 weeks or even longer if it permits. So increase the gap between the 2 cycles. This will reduce the hospital visits, reduce their exposure to coronavirus, or change to oral whenever possible, or subcutaneous route whenever possible, and give some lesser dose of chemotherapy. Because chemotherapy over and above suppresses my immunity and I cannot fight. So you can give some reduced dose of chemotherapy. And what is important is something called growth factors, which increase the WBC count, which increase immunity. So we should liberally use growth factors so that even if we give chemotherapy to the patient, his immunity is not weak. He can fight against infections. So liberal use of growth factors. So with these small strategies, with small modifications in anti-cancer therapy, we can defer elective surgeries, we can reduce their hospital visits, and at the same time we can prevent their exposure to this coronavirus. So we need to develop a balance between effective anti-cancer therapy and also preventing them from coronavirus exposure. So the take-home message today is corona is a deadly disease. Why? Because of the lethal combination of high infectivity and its translation to high mortality. And secondly, we should not say no for anti-cancer treatment to all patients. In fact, we need to develop some strategies so that we deliver effective anti-cancer therapy. At the same time, we prevent them from getting exposed to coronavirus. Thank you.